Welcome, I'm Dr. Silva, and I'm going to talk to you about 5 reasons why you should avoid Paxil, Paroxetine, the third SSRI that was developed. Real quick, I want to say I'm not saying that Paxil is a bad medication, and I'm not saying that you shouldn't take Paxil. Paxil might be perfect for you. It might save your life. I've certainly prescribed it a lot, and it's helped a lot of my patients, and there are certainly classes of patients that I think about using Paxil. But I'm going to give you 5 reasons why you might want to avoid it. Number 1, weight gain. Number 2, anticholinergic effects. Number 3, the most severe discontinuation syndrome. Number 4, the most severe sexual dysfunction. And number 5, teratogenicity. The point is, if you have options, you don't have to have Paxil. Here are 5 reasons why you might not want to take paroxetine. Reason number 1, weight gain. Of the SSRIs, it is probably the biggest offender, no pun intended, followed closely by Lexapro and maybe Zoloft and Luvox. Not Prozac, but definitely Paxil can pack on the pounds. It increases the appetite. If you don't want to gain weight, then you might want to steer clear. Reason number 2, it is the only SSRI that is significantly anticholinergic. Now, these anticholinergic effects are considered mild, but they still antagonize the action of acetylcholine at the muscarinic receptors. And this causes a host of nuisance side effects. Everything from dry mouth to constipation due to decreased gastrointestinal motility, to blurred vision, near vision due to impaired accommodation, as well as dry skin, short-term memory problems even. That can be very subtle and most people don't even notice, but you block acetylcholine and you're not doing yourself a favor. Reason number 3, it has probably the worst physical withdrawal of any of the SSRIs. I would say, certainly in my experience, it occurs in almost every patient in a dose-dependent fashion. So if you're on a significant dosage, when you start lowering the dose, you get withdrawal, dysesthesias, paresthesias, basically abnormal neurologic sensations. These can include so-called brain zaps, where it actually feels like there are little explosions going off in your head. They're not dangerous. The withdrawal is not dangerous, but it can certainly feel miserable. It tends to be worse when you turn your head rapidly, as far as the brain zaps, the paresthesias. But you can also get just general dizziness and nausea and GI cramping and just general malaise. And it can last days and days and days. So this can also happen with Lexapro and Celexa, and to a lesser extent Zoloft and Luvox. Prozac is the only one that's not going to cause weight gain. It's not going to cause withdrawal symptoms. It's not necessarily my favorite, but it stands in a class unto itself. And by the way, I have separate videos on all of these, and I've even done a video already on Paxil. It's a little bit longer than the 5 reasons why you should avoid it, so you might want to check out that video if you're curious. But moving on, reason number 4, it has the worst sexual dysfunction. And this is probably because it's the most potent SSRI. So in vitro, milligram per milligram, it is the most potent blocker of the serotonin reuptake pump. And that doesn't mean that it's going to cause the worst side effects. It depends on how much you're giving, how many milligrams you're giving compared to how many milligrams you're giving of another SSRI. But milligram per milligram, it is the most potent in vitro blocker, and that means in vivo we do see that it has the worst side effects, especially and in particular, which is often a deal breaker for a lot of people, sexual dysfunction. Anorgasmia is significant. It can delay or really block your orgasm. And that can, again, be a deal breaker for a lot of patients. For premature ejaculation, 10 milligrams of Paxil is one of the best medicines you can give. So it's not always negative, but you're going to get probably the worst side effects, the worst sedation, and the worst sexual dysfunction, and probably the worst weight gain, the worst withdrawal. Everything's the worst. It's the best, it's the most effective, but it's also the worst. It probably has the most FDA indications of any of the SSRIs. It's approved for major depressive disorder, for obsessive compulsive disorder, and I always think about Paxil with OCD because OCD can be stubborn and requires the big guns. It's also approved for generalized anxiety disorder and social anxiety disorder and panic disorder and premenstrual dysphoric disorder. So it's got a lot of FDA indications, and then we use it off-label for even more conditions that involve depression, and especially with comorbid anxiety, depression and anxiety syndromes, and especially any condition that includes both. Reason number 5, it is considered teratogenic. It's known to cause birth defects. The absolute risk is low, but more than for the other SSRIs. And back when the pregnancy risk categories were still A through D, actually I think it was A through F, it was previously considered pregnancy category D by the American College of Obstetricians and Gynecologists. We don't use that same pregnancy category rating system anymore. It changed in 2015. But of the SSRIs, it is considered to be the most teratogenic. Absolute risk is low, but it was a pregnancy category D because, quote, there is positive evidence of human fetal risk based on adverse reaction data from investigational or marketing experience or studies in humans. Nonetheless, potential benefits may warrant its use in pregnant women. It's not absolutely contraindicated in pregnancy, but in addition to the liability for floppy baby syndrome and for pulmonary hypertension in the newborn and irritability, including withdrawal symptoms, in addition to all of that, then you have to worry about cardiac structural abnormalities, atrial and ventricular septal defects. So I would not use Paxil. I would not choose Paxil for a pregnant woman who needed an SSRI, and I would seriously think about discontinuing that medication in a woman who's already taking it, who was planning on becoming pregnant. But I will defer to my obstetrician colleagues when it comes to that. So there you go, 5 reasons why you should avoid Paxil.